Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello and welcome back to the Sit and Stay podcast, brought to you by RipsyTech. As always, you are joined by RipsyTech product manager Parker Anderson. That's me. And as always, I have with me today the great, the grand, the ever so awesome Tom Tarshish, RipsyTech founder and CEO. Hey, Tom.
Parker, man, love that energy and enthusiasm. Must be the coming summer energy.
Something like that, Tom. It's not quite summer. We're about, 2.5 weeks away, but it sure feels like it over here in Georgia. We are 80s and humidity over here, so hotter than it'll ever feel in California, I'll tell you that.
Gotcha. And, quick side note, I should know better than to say summer because I recently was in trouble when we were, my spouse and I were talking to the preschoolers at my youngest school, and it was December 10th. And my spouse said, "Oh, and it's winter." And I said, "Well, technically it's not winter for 11 days." And that has created a lot of fights and tension in a don't get the seasons wrong, kids. And
I understand. Once you hit December, it's basically winter. Once you hit June, it's basically summer. I mean, you're right.
So a little life advice: don't correct your wife on non-important things in front of a bunch of 2 and 3 year olds.
That's a fair point.
See, we cover lots of things on our podcast.
We do cover lots of things. This is a podcast where we talk about, mental health practices too. That's certainly one thing. If you're a first-time listener, you might be interested to hear who are these RipsyTech guys? What kind of other resources do they put together other than this podcast? Well, I'll tell you, we've got a How to Start a Private Practice course that lives on our website over at ripsytech.com/practice. If you are on the fence about starting a practice, let us push you over to the other side. And it's a whole course that you created that has videos, very clear guides on how to go from, I want to start a private practice to I have a private practice. So go check that out if you're interested. Again, that is ripsytech.com/practice. Okay, let's dive into this week's episode. We have a very important topic for any business owner, especially one that wants to hire people that are not just themselves, and that is employee benefits. So I know that mental health practices, it's very common for people to start hiring employees because you're a provider. If you want to have other providers working under your entity, you need to start hiring those people. And sometimes that can look like a 1099, sometimes that can look like a W-2. So I assume benefits primarily, in my own experience, benefits primarily apply to people who are W-2'd. But people can start by bringing people in as 1099. So I guess my question is, what point should a mental health practice owner be? At what point should they be considering, hey, I need to start offering some people benefits?
Yeah, and it's a fun topic that we've done lots of different things over the years, and the other piece is you can still offer benefits to 1099 employees.
Oh.
I'd say that for our average listeners who are actually clinicians themselves, you're not really supposed to have 1099 employees if they're doing the same thing you're doing, because your contract employees you bring in who bring a skill you don't have, and so you sort of leave them on their own. If you're a non-prescriber and brought in a prescriber, you could make a pretty good case that that's a 1099. But anyway, those semantics aside,
Gotcha.
It is when you're like brand new starting out, it is much safer and better as a business model to be lean with your finances and expenses. But then once your practice gets going and you're covering costs and then you're doing a good job and a couple of your people with a good reputation who don't like doing the administrative piece but want to work with you are like, hey, can I work that? Right. Then you get to that place where, wow, I need to put together, a real job to compete with whatever size clinic or huge hospital systems. And the ultimate reality is, I think when you're small and people understand that you're starting out, and they'll be happy to come and join you for mission or vision or mentorship, and benefits may not matter as much because they know you're a new entity. But then after you get 5, 6, as your employee count goes up, all of a sudden it's not just 4 people pushing together to see patients. You've become kind of a real company, and then you need to think about seriously offering benefits, and because you at some point then you're competing with so Kaiser Permanente out here on the West Coast and other places is a huge employer of mental health clinicians. They don't employ enough, though. Google.
Yeah, it's
lawsuit.
interesting that you actually say that, because I've had Kaiser in the past, and trying to get a mental health provider was like a train wreck of a process. But okay, interesting. Okay, but say more about that.
Yeah, no, I'm just bringing it up because often you're applying for a job. You sort of it's the salary and how many, is it a full-time job and what's the salary? And Kaiser does do what I would say it's a reasonably smart recruiting tool where they'll sort of list out your salary, and then they'll list out the benefits offered, and they'll actually put sort of a dollar sign by each of the benefits you're getting. So if you're, say you're a master's level therapist and the salary was $100,000 a year, well, they're going to list out all your different benefits from PTO to retirement to holidays to health insurance costs, dental, vision, whatever they're offering, and that number can be quite large. And they'll say these are worth another $75,000, which is a good recruiting tool because people tend to only look at the salary and actually don't look at the benefits as hard initially.
So it's kind of like saying, here's your salary, but also kind of add this number to it. And that's kind of really what you're getting at the end of the day. I mean, you're getting all these things that are worth this much money. It's not, because when you initially brought it up, I was thinking, oh, is it, I make this much money, but, oh, they're taking this much money out. But it sounds like it's the opposite. It's, well, you're also getting all this other stuff too. So think about that and how the other people are maybe not giving you these ththings, and what the total number might then become.
That's spot on. And I know this from experience and from having a 100 plus employees. People don't really understand or appreciate the cost of some of these benefits. And definitely in the past, we've lost people to our clinic because they found a job. Well, this other job pays an extra $20,000 a year, but it's a 1099 job. But they're just looking at the salary difference, and they don't understand, well, you're about to lose 8% in Medicare and Social Security. And then guess what? Those 10 holidays and 4 weeks of vacation are worth a lot of money. But it is hard to communicate that to employees. Potential.
Okay, so yeah, when it comes to, I mean, what are the competitive benefits? Like, what are the most important ones that you think reel people in? Or I don't know, maybe it's kind of a double question. It's like, which ones are ones that you kind of have to make sure that you do, versus which are the ones that might make you a little bit more competitive versus somebody else?
Yeah, and I'd say, there's one benefit that a lot of states mandate you give your employees at least some, and that's sick time. So most, and this is a protection against employers being unethical to various classes of employees by sort of saying, hey, I think in California you have to give 1 week of sick time for full-time employees, and like the state has mandated it no matter what size employer you are. And there are other rules by state and then by federal law that kick in that you have to be mindful of with benefits. But I would say the number one, I think this is true of anyone at any job, but our health insurance system is rising, and the costs are rising and rising. And this is what is definitely most important to a lot of people. You will find people who are covered by their partner's plan. And if you can't offer health insurance initially, you can still recruit people to your mission and message who have coverage through other means. There are other clinics, with Obamacare that when it was more affordable and there were more choices, that gave another venue where health insurance was maybe less important. But I would say from employee experience,
I haven't heard somebody call it Obamacare in a very long time. I'm not gonna lie.
Yeah, fair enough. I usually go to the California covered, but then I was thinking, I don't know what the federal term is, but I think Obamacare is
the
still
Affordable.
Yes.
Yeah, well, Affordable Care Act.
Affordable Care. Thank you, Parker.
Yeah.
Okay, but
It's funny because I was ChatGPTing what that was like 2 days ago, so it was perfect timing.
And for both for RipsyTech, what was our first benefit we offered?
To me,
employees.
health insurance.
Yeah, so we did go health. I feel
I think before health insurance, you might have offered just like PTO, paid time off. I'm not sure.
Well, that is probable and likely. Well, and it's so. Well, let's jump to PTO as a benefit first, and then we'll come to health insurance. There is a big difference between service industry PTO and sort of white collar non-service professional PTO, we recommend in the private practice course that you put together sick and vacation time into one category called PTO. That for many reasons, this is a little bit more employer in support of the employer. But if you give people sick time, 100% they will use all their sick time, whether they're sick or not. If you put it in as with vacation time and call it PTO, people are more likely to power through to the workplace.
Interesting.
Which, if people are really sick, you want them to take days off, and we're also fully in support of days off for mental health, because that would be hypocritical. But
touche.
It is better to combine it into a PTO category. It's often PTO is not even. It is usually listed as a benefit. 3 weeks PTO, 4 weeks PTO, 10 paid holidays. People often don't appreciate the cost associated with those benefits when you're in a white collar service industry, which is what mental health clinicians are. So you are highly educated, skilled workforce, but you earn money by seeing patients. So it is a service industry. You provide a service. So when you have a clinic holiday or when staff takes a week off, it 100% affects your clinic bottom line. Right. Versus with RipsyTech, Parker, if you say, hey, Tom, can I take these 3 days off and just hustle a little more the next week? I can say, no problem, Parker. And it's actually, you don't even need to use your vacation hours, and you can make your week up later. And the business doesn't suffer directly from, in direct revenue right then. And so a lot of the studies in, tech company or other industries, accounting firms, et cetera, that aren't based directly on billing clients, they'll have a like take as much vacation as you want policy, because they've also done the research that if you offer people, when people are offered that, they tend to take less than 3 weeks a year. Versus if you say, hey, 4 weeks a year, and after every 5 years you get another week, people are more likely to take that vacation. And it's especially bad now for employees, Parker, because the job market is not good. And so you could definitely say, oh, take all the PTO you want. By the way, here's the people who took the most PTO last year. Who wouldn't want to be them? I mean, people wouldn't be that direct, but people are worried about their jobs, and if they're taking
that's a fair point.
Which
taking lots of time off, right?
But
Okay.
for a clinic, right, deciding to give 10 holidays and 4 weeks of vacation, that's 6 weeks of revenue lost from that clinician seeing patients.
Right. That makes a lot of sense. I did not think about it that way. I mean, I have always thought about how, at a clinic, the providers are the money-making machine, right? You're not making money unless they're seeing patients. But I guess I didn't think about that in terms of myself, whether I am working or not working for, the type of company that we are currently representing. So, that doesn't mean I'm going to start working any less, though, Tom. Don't worry.
I have, no fears there, Parker. You tend to work a little too much, but separate podcast.
Don't tell me that too much. I might take advantage of it. Well, okay, yeah. So, what are some other benefits that we should be talking about?
Yeah, so then let's come back to health insurance, which I think is number one on everyone's mind. Knowing that health insurance costs are skyrocketing, the rate at which commercial insurances increase their fees each year far outpaces inflation, and that for a family of 4 to get health insurance through the Affordable Care Act, it's the numbers are drastic, and with recent subsidies ending, many people have just canceled all of their health insurance. So there's health insurance, and then so let's talk about health insurance a little bit as an employer. When you're signing up for a health insurance policy, there's different, again, this is a state by state issue. I shouldn't say issue. There are varying regulations state by state. In California, you could go to Kaiser, and you could go to Anthem. You could go to some big insurance providers and reach out and say, hey, I want to get you give my employees the option to have insurance with you. And they will give you a list of, we've talked about before, each of these insurances has 100 plus different insurance plans. And they'll say, sure, we'll happily take you on. Here's the costs for these different levels of care that you can get with your insurance. And then what you do as an employer is you decide, okay, what % of the costs are we going to cover, or are we going to give a fixed dollar value? When we initially, and in California, we have I do like this company. I've used them the entire time. It's called California Choice. And a lot of smaller groups use them, as well as when we got larger. But what it does is, instead of having to there are a lot of companies that just go to Kaiser because it's the cheapest and that's what they can afford. California Choice gives more selection of different insurance types to employees, which is important if you have out-of-state employees and things like that.
Yeah, nearest Kaiser to me is like an hour and a half away. So
yeah, so that would be inconvenient. So with California Choice, you can say, yeah, hey, we meet criteria under a small business for right now. They'll give you, okay, here's pick 20 of these plans that you want to offer to your employees. And then, so initially we covered a percentage. So when we started, one of the Kaiser plans was the cheapest, and we said, we'll cover 100% of the cheapest health insurance plan for our employees. So that means you could come work for us and you could get a health insurance plan that you paid nothing for. And then if you want a better plan, that amount, that 100% of the cheapest plan, that would be applied to the cost of your plan. So most of them, if the cheapest plan is $700 a month, the most expensive might be $1,000 a month. It's not too drastic there. So we're covering $700. You want the most expensive. It's an extra $300 a month pre-tax from your paycheck. And then you let your employees choose. The problem with doing it as a percentage as an employer is, Parker, what is the number one determination on health insurance costs? This is why health insurance is cheap for you and very costly for me.
I actually have no idea. I don't know the answer to this.
It's age. It is age.
Oh. I was thinking in terms of like for employee versus an employer. But yes, that makes a lot more sense.
Yeah. So if you're agreeing, so when we started, we tended to have, and it's actually, if you're 45 or under, it's all actuarial tables. So you think about who gets sick. In general, it's older adults. And so when you started, like if you're a new group, you're still, even if you're just finished your psychiatry training, you tend to still be early 30s, and then you tend to attract people around your same age, or that's who you know. And front desk staff tends to be younger. But then as we grew, we got employees of all different ages, and then all of a sudden you see that the cheapest health insurance coverage plan for someone aged 59, it's not that $700 a month, it's $1,700 a month. And it makes it, it makes it very hard to plan your budget out to very fine detail when you have a cost you don't 100% know. So we actually switched to doing a fixed dollar amount. We pick a dollar amount that feels reasonable for the employees, and that way we know exactly any employee who comes is going to get this much money towards their health insurance. We California Choice will do health insurance, dental, and vision together. And there are a lot of other companies. I think Anthem offers health and dental. There are some of the big health insurers will tie in with the dental and vision, or sometimes you have to do those separately. But that is where, you might have to decide, if you're a brand new practice, hey, we have these insurances, but we can only cover $100 towards it right now. The rest at least is pre-tax, and we'll take care of the taking the deductions out. But as we get bigger, we'll pay for more people's health insurance. You have to give the same benefits to everyone, so you can't discriminate, which was it's another learning curve, because on some level, well, hey, doctors are used to getting these very nice benefit packages, whereas a front desk person may not expect that as much. So like, okay, well, I want these benefits for the doctors and these worse ones they're like, sorry, that's very illegal. And if you think about it for a minute, that makes sense. So.
Are there any differences as far as benefits that can be offered between a non-profit and a for-profit?
There's no difference really. In fact, another learning piece for me was that nonprofits can actually offer 401ks. There are these other retirement plans that nonprofits are eligible, 403bs, and there's 457s. And sometimes those have lower fees. There's pros and cons to everything, but 401k administration is much simpler paperwork wise. But so as a for-profit, there are, like, you can't do a couple certain retirement plans. That's the only thing that I know for sure about. I would asterisk that. I would not call myself an expert on that one topic.
Okay. I mean, are there any, unconventional benefits that are out there that one might consider offering?
Yeah. So I think our standard ones, Parker, are holidays and PTO, medical, dental, vision. There's often a little supplemental life insurance piece within there.
Right.
And then we get
disability insurance.
Yeah, so then there's disability insurance, and we like to put in a nice This is hard when you're very small to put in a good disability insurance, but once you cross 5 or 6, depending on the policy, getting a group disability insurance, especially for mental health clinicians that have a higher disability rate than the rest of the population, is a nice perk to provide. And so we actually pay a lot of attention to the disability insurance, and our nonprofit is about to cross the number of threshold employees to offer that. And then there's retirement, which this is also mandated by states. They don't mandate a contribution necessarily, but they do. A lot of states mandate that you have a retirement plan for people to put money into pre-tax, which is a good requirement because people should be saving for retirement. But then traditionally you decide, are you going to match a dollar amount each year or up to 3% of the salary? And I'd say it's pretty standard for academic centers and other institutions to have at least like a 3% match, that if you work for the company at least 4 years, you're 25% vested in each year. Going to non-traditional benefits, a company can be very creative and do whatever they want, right? And in Silicon Valley, we have some companies that do very creative benefits.
They sure do. I mean, I think of like, my mind goes to like, I don't know, gym memberships and things like that, or just like the company gym with access to a shower and all of that. I'm like, that's a cool benefit. But yeah, in Silicon Valley, I mean, the like stereotypical, maybe like when the Silicon Valley TV show was airing, I think that's kind of like the prototypical Silicon Valley era that we think of. And I think it's certainly changing a lot in the 2020s. But sitting, I don't know, having access to yoga balls to sit on for your chairs, or things like that.
Yeah, I think some of the more popular ones, but
Meal plans.
Bringing in, like, giving people a meal credit, cell phone credit. Again, things have been shifting a little bit because it is a employer market right now, because there are a lot of people looking for jobs. But a lot of companies had started doing student loan reimbursements, and there were some tax benefits depending. Us as a nonprofit, people are eligible for student loan repayment just by working for us. So that's not a benefit that nonprofits should advertise more for. If you're in a public service loan forgiveness program, has not been dismantled yet. Childcare. So.
Oh yeah.
That
sounds great.
This is a female-dominated field, mental health clinicians, and so if you think about what would be a valuable resource if you want to bring some of the best clinicians to your practice, hey, your kid's on site getting childcare, and you can bop in and see how they're doing, and subsidized or fully funded. I think, Parker, this is why a lot of this field has gone online, and with telehealth is for this, even though a lot of people don't necessarily like doing all telehealth, the flexibility or convenience, especially when you have young kids, is it makes it worth it.
Totally.
Yeah. And then I'm trying to, I don't think, what would we do? We would bring in coffee cart. We would do like various other.
Oh yeah. I remember those things. I mean, so in the context of, the clinic that I used to work at with you, the clinicians would be able to do things like journal club, or, like case studies, or, case reviews, or you'd have like speakers come in. I imagine those could be kind of sold as benefits, right?
Yeah, well, and one of our current benefits is everyone gets an educational stipend, whether you're a clinician or not. So that can be used for any expenses deemed to be relevant to work. And we did give people, depending on what percent time you were with us, people could have protected time for special projects. So in a white collar service industry, saying, hey, you're interested in advocacy around this, or hey, you're passionate about working with this population, we're going to give you 1 or 2 hours a week where we give you your clinical credit, but you get to work towards whatever your passion is. And then it's another real cost to us because we're losing an hour they could be seeing a patient. But though, again, if that's a recruitment tool and good for morale, and that gets you another employee, that is the whole point of benefits. And you create the best workplace, you will make up for, maybe you lose some margin in what you could, squeeze out of your providers. No, of course we don't squeeze anything, but you make it up for in volume because you are the best workplace, and it's much more enjoyable.
Okay, I mean, let's say I'm a small employer and I'm growing and I'm listening to this right now. I might be thinking like, well, where do I even start? How do I even set up a benefit? Is there somebody I have to go through? Is there a document I need to write? How do I go about this?
And this is another interesting thing about this insurance field, is that you do need to have a broker. I'm pretty sure this is throughout the country and not a California thing. But so when I just called up California Choice and said, hey, I want to get California Choice active, I can't just do that as a business owner. I need to get an insurance broker. And I think it came around for protections. I'm not sure in which direction. But California Choice then is like, yes, we can definitely help you. By the way, here's some brokers that we work with. And then you actually get connected with the broker. It is a service that's actually, you don't have to pay them anything. They get a cut from the insurance plan that you sign up with. I actually don't know what the cut is or how that relationship totally works, but it is nice to have someone that you can say, hey, I'm a new clinic, I don't know about this, but here's what I'd like to offer my employees. Can you put together some options? So that is find an insurance broker and let them do the legwork. I think it's required.
Huh. That makes a lot of sense. Okay, so what about, are there any mistakes I can make? Both on, because now that you've mentioned the insurance broker, now I'm thinking about, are there mistakes I can make when I'm, starting to offer benefits to people, but are there also mistakes I can make when I'm having conversations with the insurance broker?
I don't think too much with an insurance broker.
Okay.
I think the biggest mistake you can make with benefits is offering too much before your business is ready to pay for the benefits.
That makes sense.
It's sort of that, I did doing the cover a percent of the health insurance and not being aware at the time that some employee, that's a drastic cost difference for someone who's a 20-year-old front desk person versus someone who's a 58-year-old clinician. And so
right.
that you in your budget, you thought, oh, that'll be like $200 a month, and it's actually $1,000 a month. That's a serious mistake for a new clinic to make. And Parker, we've talked about it. I give this on the budgeting guidance that we give. We sort of do if it's your employees, I think you should spend at least 70% of your revenue kind of directly to your employees. So that means you look at what your revenue is and your projections, and you know that well because you've done our fine detail budget plan. But and then if you have kind of W-2 employees but not much benefits, well, if you have W-2 employees and you want to offer benefits quickly, the breakdown is usually about 50% to salary and keep 20% of that for benefits. And then that 20% needs to cover their PTO, their health insurance, the retirement cost, and other benefits. So if you are in a situation where you just have 1099 employees, you could give that whole 70% to them on their 1099 check. And there are many entities that do a split somewhere between 60 to even 80% I've seen for some of the telehealth companies that have lower overhead. The other 30%, 20% goes to what, Parker?
Gosh. Social Security?
No, that's actually it's really good you made that comment. And that's why I ask you questions sometimes, because it helps realize things that we miss. So sometimes it's valuable. But that the taxes are included also in the benefit cost.
Interesting.
Yeah, so there is that employer share of Social Security and Medicare. That is a benefit. I think that's the one that, like, with Kaiser pudding, we're actually paying, our mandated by law percent of your Social Security. That feels like it's pushing it to me, because every employer has to do that. So, but that piece aside, that's considered a benefit. But in our 100% clinic revenue model, basic budgeting, 70% for employee, 20% for overhead for the cost of running your business.
Right.
Which actually includes other employees that are not delivering service, but that you need. And then 10% for profit.
Right. The admin person did not generate revenue today by working at the front desk, but they helped support the operations that did. That makes sense.
Yeah. So making a mistake where all of a sudden you put in a benefit that your company wasn't ready for, and if it's not that hard when you're small to push your employee costs to 90% of the revenue they're generating, and then you're not leaving enough for overhead to even cover the cost of running the clinic.
I'm glad you brought that up, because I think especially when you might be running a solo practice and you're making transitions towards just more providers, just more people, thinking about, let's say I need to pay somebody to do my billing, or I need somebody to do my scheduling, having a clear breakdown of just, how much I should be allocating towards that, I think is really helpful.
Yeah, and you're right. If you're a telehealth only provider and you do all your scheduling and communicate directly with your patients, that could slip your mind completely. But there's no way every one of your clinicians will want to do that. And in fact, it's less likely they will if they are coming to work for someone who deals with all the administrative piece. So on some way in today's world, a benefit is, hey, we have an admin person who will take phone calls and return calls to your patient, and will do your scheduling. And that is less likely now. That a lot of it is automated, which is great. But the reality is, for mental health, people still want the phone call and want to speak to a human. And even though, commercial insurers are trying to push people into, sign up automatically and use the AI chatbot, real world data shows people much rather give a phone call and talk to a human.
Yeah, no, 100%. I submitted a support request to a service that I forgot that I subscribed to today, and I think the support response I got back was AI. I'm not sure, but it was just too perfectly written, is all I'll say. I did get my refund, though, which feels like a massive accomplishment. All right, Tom, anything left unsaid on benefits?
Knowing the size you want to get to is an important factor with the benefits. And it is not hard. And we did that initially as a nonprofit years ago. We sort of actually, when there was 12 or 13 of us, we sat down together and said, hey, we have this much money to offer a benefit. What do people want? And is it an extra holiday? Is it health insurance? Hopefully there's a clear majority, but so sometimes you can do that. I don't always necessarily recommend that, but if you want to get to a place though where you have 100 employees, you should be thinking about that from the beginning and planning out your benefits so that it is something that goes smoothly with your growth.
Well said. Well said.
And that triggered, you're not trapped into any benefit level. So
Oh, yeah.
each year you can tell the health insurance company, hey, we were paying $750 a year last year. We're going to contribute $1,000 a month. We're going to contribute $1,000 a month to our employees this year because our company is growing and has more revenue. So you're not stuck into your options. It's more thinking about having a 3% retirement match when there's just 7 employees versus 100. You have to be aware of months that are slow in the service industry. Do you have enough money in the bank to cover those months for these benefits and things like that?
Very well said. Even better said, I would say. All right, cool. Let's move on to a word from Rye, our AI mental health practice advisor.
This is Rye, your AI mental health practice advisor. Practice owners often ask, what's one thing every clinician should understand about CPT codes? One thing every clinician should understand about CPT codes is this: the safest code is not always the smallest code. Don't underbill out of fear. Bill accurately with confidence. The right CPT code should reflect the service provided, the time spent, the clinical complexity, and any applicable add-on codes, with documentation to support it. When the care is real and the documentation is clear, your coding should reflect the value of the service provided. For more practice advice, ask me a question at RipsyTech.com.
All right, Tom, do you have a mental health business moment for this week?
Parker, it is potentially a future podcast issue, but
something you experienced was full episode worthy.
It was full episode worthy, and the concerning thing is I do think that there is an attack going on by, is that too strong a word? I'm not sure. It continues to get harder and harder to deal with commercial insurance companies, which is bad for the field. Right. And sort of out of the blue, I won't name the insurance company because we'll see if things get resolved. But sort of out of the blue, we received a notice that, hey, we're pausing taking any new applications for providers.
Oh, okay. Yeah, you told me about that. Oh, yeah. Oh, yeah.
And we have new doctors starting, but more than that, we have a backlog of patients from this insurance company, as well as the last 2 days we got they themselves, the insurance company, reached out to ask if we could see more patients. I can't. You're saying you can't accept. You're not going to start the credentialing. So I'm a little. This definitely has gotten me miffed. We will see how this resolves. I am pushing through. I'm just in can we be logical phase first, and then we'll see where we need to go. But it feels unethical and not legal. But
I mean, it's an oxymoron to say, well, hey, we have this patient, and could you see them? Because they need to be able to see somebody, and for them also to be saying well, we're not accepting applications for new people that could be seeing the people that we're reaching out to you for. It just doesn't make any sense. And for that window of time, I believe it was a 3-month window, if I recall correctly. That's a long time. That's a really, really long time. So that just blows my mind. I don't know how that doesn't affect their business just completely outright. And I just
it helps their business, Parker.
Oh, really?
Because they're
For
saving
not having
money.
to pay more people?
Yeah. It helps their bottom. Well, this I don't even know. I don't think that's cynical, but that it as far as a publicly traded company spending, it helps their business by not providing that service. I'm sorry, it helps their bottom line. So.
Trying to think of all the like audible things that I could do for people who like just. All right. For those
we could
listening,
get one of those
I hope you
no
enjoyed that.
buttons. No.
Yeah, that was not easy. That was hard. I don't know. So I should get a sit and stay soundboard ready to go. All right. Well, that sucks. What a way to end a podcast. Well, yeah, keep us posted. I don't know. Maybe that's going to be the next episode. We'll see. I'm going to go ahead and close out this episode. So if you enjoyed the episode, please leave us a rating or review wherever you are listening. And if you want to get in touch, send us an email at sitandstay@RipsyTech.com. Tom, this has been fun, and I will see you next time.
See you, Parker. See you in the summer. Peace out.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.